KSMQ Health Connections. Local healthcare providers answering your medical questions. This week's topic, nothing to sneeze at.
Good evening and welcome to KSMQ Health Connections, where we connect you with some of the finest minds in the medical field. I'm Eric Olson here at KSMQ in Austin, live on Tuesday night. Thanks for tuning in. The latest word from health authorities is that so far the flu season hasn't really begun yet. That's the good news. The bad news, those numbers are starting to inch up, and no one really can predict how bad this flu season might be. Last year was a very serious year in the United States. More than 710,000 people were hospitalized, which is about 3 times the average number. And the Centers for Disease Control estimated that 80,000 people passed away, died, the highest number of deaths in 40 years. So it's interesting to note that the percentage of people who got their flu shot last year was fairly typical. 58% of children, this is nationwide by the way, not southeastern Minnesota, 58% of children got a flu shot. That number dropped off for adults between the ages of 18 and 64, where only about a third got their flu shot. But for those 65 and older, the number was 60%, which was pretty close to the vaccination rate for children. So after looking at those numbers, the obvious question to ask right now is, have you gotten your flu shot yet?
Have you gotten your flu shots? Yeah, yes or no, and why or why not?
I did. I always do. It's very important that you get them. I mean, I think anyway. You don't want the flu. You get sick, you lose time at work. And I believe in it. And I think I've been really fortunate that I haven't had the flu for quite a few years.
Yes, I did. And why? Because it does keep me well.
All right, have you gotten your flu shots? Why or why not?
No, because I don't get sick that often. Once in a while I'll get them, but I didn't get one yet this year.
Yeah, I always get my flu shots, and the reason why I get them is because I'm a type 2 diabetic, and I got to watch out for my health.
Have you gotten a flu shot? Why or why not?
I have not gotten a flu shot this year because I don't think they do a lot of good. I usually don't get the flu, so I don't usually get a shot. My husband always gets a flu shot because he believes in them and he thinks that they prevent him from getting the flu. But I don't ever get the flu and I don't get the shot.
I haven't got a flu shot. I haven't in a really long time, and so far I haven't got the flu. So I just kind of figure stick to what works so far. But actually I think I have to get one this year because I am pregnant and I think they require it or highly suggested or something. So this year might be my first year in many years that I get a flu shot.
So, whenever we talk about the flu, we really need to also talk about pneumonia because the two are interrelated. Now to the phones. If you have a question about the flu or pneumonia, you're watching us tonight, about getting a flu shot maybe, or you're wondering whether you should consider getting a pneumonia vaccination, give us a call. The number is 888-255-0121. That's 888-255-0121. Or shoot us an email, healthconnections@ksmq.org. You see both there on the bottom of your screen if something comes to your mind. We have registered nurses right here in the studio to take your call or email. And the person who can answer those questions, Dr. Sarah Scherger, practices pediatric and adolescent medicine at Mayo Clinic Health System. Thank you very much for coming in.
Thanks for having me.
Yeah, wonderful to see you. We should point out, when we heard those people, it was kind of like a third no, 2/3 were getting them. Do you get a lot of people questioning the need for them in your practice?
Yeah, I mean, we probably get people questioning the need for the flu vaccination more than any other vaccination that we give. Now, I'm a pediatrician, so people are a little bit more up on their kids' stuff normally than their own, but yep.
But the best medical experts are saying it's necessary, right? Or what do the experts with the federal government, for instance, and in your profession, what do they say about that?
Yeah, so it's recommended for everyone. They have special categories of people that they really recommend it, but they do recommend it for everyone, no matter how healthy, no matter how you've never been sick. They recommend it for everyone. They especially recommend it for children, particularly those under 5, even more for those under 2, and then for older adults, those over 65, and then for anyone with other chronic health conditions, asthma, the man mentioned type 2 diabetes, those conditions.
And I don't know if it's like around our house, I get something that might be a cold symptoms or my nose, and I automatically think, oh no, I have the flu. I think there's probably a lot of people identifying something as the flu that it is not the flu.
Yeah, influenza is a typically very serious illness with sort of an abrupt onset. So, you know, I'm walking around healthy today, and then tomorrow I have 103 fever, and I feel very ill. I might have a cough, but I get very achy, and I'm just exhausted, and that lasts for 3 to 5 to 7 days. Other people talk about the flu, and they think about kind of a bad cold. Like, I have a cough, it kind of gradually came on. It's you know, I don't feel great. I might have a headache. And then people also talk about the flu, where they talk about like the stomach flu. My husband is sort of notorious for saying, oh, I think I have the stomach flu, or I think I must have the flu. And it's like a GI illness, and that's not influenza. You can have influenza with vomiting sometimes, but that's much more likely to be like a viral gastroenteritis.
Quick onset and lasts for a while.
Yep, with fevers.
And then you should go see somebody, maybe, or no?
Yeah. Some of that depends. So there isn't a ton. There are some antivirals for the flu that we can treat you with, particularly if you're at risk of complications. So if you're in those at-risk groups, it is best if that started within 2 days of onset of the symptoms. It's not an antibiotic, though. It won't stop you from being sick. You know, if you have pneumonia, or if you have an ear infection, I think about that because I'm a pediatrician, I can make you feel better quickly. If you have the flu, and I give you Tamiflu is the one that people think about, I give you that, I can make you feel better. I can make you not as sick as you would be normally, but only a little bit. So instead of being sick for 5 days, you'll be sick for 4 days. It doesn't mean it's not important, but it's not a magic wand.
It's what we have. Thank you. Sarah Scherger, Mayo Clinic Health System. As I mentioned, we have some RNs taking your calls and emails. One of them tonight, Nathan Hauber, who works at Prairie River Home Care, graduate of the nursing program at Riverland Community in Austin. Nathan, do you have a question for us?
You bet. Lois from Austin called in. She said that she typically doesn't have her children immunized for the flu because she's concerned about the additives in it. But the last time she saw her mother at the nursing home with her children, she was asked to consider having her children vaccinated for the flu before the next time she came back in. Why is that?
Well, we know that our older population, so those over 65, are at high risk of flu complications. And then because this specific person's mother is in a, kind of a assisted living or nursing home where there's lots of other people, if they introduce the flu to that nursing home, multiple people could get sick, and that could be very scary for those older adults.
So when you say other things can happen, that would be much more serious than the flu, other complications.
So the flu by itself can be very serious. The flu by itself can give you pneumonia. You can get a viral pneumonia from flu. You can get you can get something called myocarditis, which is an infection of the heart muscle from the flu. You can get breakdown of your muscles from the flu. But you also set yourself up for secondary infections like bacterial pneumonia is probably the most common in those older adults.
We're talking to Dr. Sarah Scherger, Mayo Clinic Health System. We're getting a lot of calls tonight. The subject is influenza. Nathan, what do you have for us?
Yes, Laura from Albert Lee called in. Her question was she had the flu last year, and after she had the flu, it was suggested that she get the flu vaccine. She had not had it before she got the flu. Why would they suggest that?
Well, so to not get it again, I guess, right? Or-
Yeah, so there's different strains of the flu, and the vaccination actually protects against 4 strains normally. There's one version of vaccine that they're kind of phasing out that only protects against 3, but most people get what's called the quadrivalent, or the one that protects against 4 strains. So they often recommend the flu vaccination even if you've gotten documented flu, because you could get other versions of the flu.
All right, very well. Dr. Sarah Scherger from Mayo Clinic Health System is our wonderful guest tonight. As we mentioned at the beginning of the show, 80,000 Americans died from the flu and pneumonia last year. That made it one of the top 10 leading causes of death in this country. If you have a question about the flu, pneumonia, please give us a call now or send in your question. Choose. Did you get that? That was great stuff there, because it's like a sneeze, you know, choose your method to get. It was very good. Sarah Scherger is with us. Johns Hopkins, that's where you did some of your medical work?
Yeah, that's where I did my medical school.
Okay, wonderful. And you've been in the region, how long? Where have you been?
So I came to residency in Rochester, and I met a farmer, and we got married, and I came here after residency, so I've been here for about 6.5 years.
Wonderful. Nathan has another call for us and a new question. Nathan?
Yes, Isabel from Austin called in. She had a question about all of the vaccines that children are given shortly after they're born. She's wondering, is that safe?
Okay, it's kind of a non-flu question,
Yeah.
but I'm kind of the judge here, and I'll allow the question be asked. Okay.
Okay. So the short answer would be yes. We think that they're safe. We have data that would suggest that all of them are safe. I think people who get concerned about things like that have a couple of issues. They think that's a lot of shots for a baby. And the truth is that the baby is exposed to things called antigens, which are in vaccines but are also in the world, as soon as they're born. Hundreds of thousands of things that start making your immune system function immediately as soon as they're born, and the amount of those antigens that are in vaccine are very tiny compared to the amount that's in the world, and so it's safe. It feels like a lot. As a mom, I have 2 kids. It felt like a lot, even though I do this, but it is safe.
Mm-hmm. And you were chatting about, back to influenza and the flu, that you can see in America, in the United States, we get kind of a east to west when people catch this every year.
So it often starts earlier. So your specific question was, when did the flu vaccination come out for this year? Because it changes every year, but and it actually comes out in about July. We don't often start getting our supplies of it until October, because they start giving the flu shots regularly in places like Florida and Georgia and Louisiana. That's where they're seeing higher activity levels now, and we will start seeing activity soon.
Mm-hmm. And over the course of time, I'm sure, you know, statistics and so on, that these flu vaccines save a lot of lives. I mean, from back when there was none.
Yeah. So they do. They save lives. They have studies that show more percentages. So people talk about, I still got the flu when I got the flu vaccine, and that's true. Some people do. Depending on the year, it's somewhere between 40 to 60% effective from preventing you from getting the flu. But if you do get the flu it's very good at, first of all, preventing you from ending up in the hospital, and second of all, if you are unlucky enough to end up in the hospital, preventing you from needing to go into the ICU, or preventing you, if you have to be in the ICU, from having shorter hospital stays.
Okay.
So it's not just prevention.
Real good. Nathan Hauber is with us. In case you're just joining us, this is KSMQ Health Connections live here on KSMQ. Nathan is our RN taking calls and emails from you all and has one for us. Nathan.
Yes, Luis from Austin called in. He has a question. Is there mercury in the flu vaccine? If there is, why is it there, and is it safe?
There is not mercury, there used to be, called thimerosal in vaccinations. They first took them out of vaccinations for the flu vaccination given at from 6 months to 35 months, so the ones we give to babies. And then they began using, and it's used as a preservative for multi-dose vials. So the vaccination that we give at the clinic right now, even the adult vaccination, is a single-use vials and does not contain thimerosal.
There's a lot of concern over the flu vaccine. Is that a new revelation in the recent years, or has there always been concern? I don't know.
I think there's been increasing concern, I think, about vaccinations, but the concerns about vaccination probably started with the initial vaccinations,
sure,
with like the smallpox vaccinations.
Absolutely.
Things like that.
And they develop, each year they have to be new, right?
The flu
why is that?
The flu is kind of tricky, so it does two things. It shifts and it drifts, so each strain changes a little bit every year, and it sometimes changes a lot, which is where they talk about, oh, the vaccine doesn't work very well this year, it's not a good match, because they guessed wrong, or not necessarily even wrong, but sometimes the virus just changed.
And so then mid-season they might change the vaccine.
They can't change the vaccine mid-season, unfortunately, because they have to grow it in eggs most of the time, and so it's already produced.
So that's a lot of quick work by scientists to try to develop this year's vaccine. And then do you get medical information about, so here's what we know about this vaccine this year?
Yes, it's always, so we get emails from the Minnesota Department of Health every year, and every week of the flu season we get an update about how widespread the flu is. We also can anytime, and so can the public, go to the CDC website and get flu tracker information and information about the strains of the flu that are around.
Are we looking for a big year this year?
Gosh, I hope not.
Yeah.
Hopefully not. So last year was a bad year, as you mentioned. They did some work on the vaccination and matched it better with the circulating strain from last year. So they hope that it seems to have a better match. So we hope for a better year.
It seems to me like it's more convenient these days than ever to get a vaccine. A lot of pharmacies, some places will go to your place of employment, not just Mayo Clinic Health System. Are those all the same, like the vaccine? Like, can you be sure that the place, the pharmacy you go to is the same as you get here or there?
So it might be a different brand. I don't know the deals that pharmacies have with different brands, but for the most part, they're the same. They're all the same. If they're a quadrivalent strain, they all are the same strains.
Okay. So the recipe, it gets sent out to the companies and they make them real fast, because sometimes they run out,
Yes. We sometimes have brief shortages, and then we'll get a shipment.
Okay. Thank you much. Hey, we have about 7 minutes to go. Still time for you to call, email your questions, 888-255-0121. Email us, healthconnections@ksmq.org. More with Dr. Sarah Scherger from Mayo Clinic Health System right after this. In the time remaining, let's talk a little bit about pneumonia. How are they related? How is it related to flu? Is it?
Yeah, so you can get pneumonia from the flu virus itself. You also can set yourself up for what we would call a secondary bacterial pneumonia, which is what most people think about when they think about pneumonia.
And that's lungs,
that's
right?
Lungs.
Upper respiratory or
lower respiratory. Yeah, so upper
Okay.
is like cold, cough, runny nose. Lower respiratory is that deep cough, the chest pain.
And that can be a byproduct or it comes after you get the flu sometimes.
It's sort of like you start to get better from the flu and then suddenly you're back to square one, and at that point we would definitely recommend that you come in and be seen, because you should be getting better, and that can be a sign of some secondary bacterial pneumonias.
Okay. Nathan on our phone line has a call.
Yes, Bob from Dexter called in, and he's wondering, in years where the vaccine is not a good match for the prevalent flu germ going around, should he still get the immunization?
So yes.
Yeah, and we can't talk specifics with anybody. I mean, check with your doctor, I think we would say first, but,
yes, but
it's probably a good bet.
So we would recommend, even if it's not a good protection, that it's still, studies have shown that it's still protective against getting as sick and getting admitted to the hospital and getting admitted to the ICU, even if it isn't going to keep you from getting the flu. Like last year, it wasn't a great match. But.
Is there a pneumonia vaccine that's different from influenza vaccine?
Yeah, there is a vaccine against a bacteria called strep pneumoniae that causes a subset of bacterial pneumonia. There's actually 2 vaccinations, pneumonia vaccinations.
But that's not anything that is recommended. I mean, I don't hear about it in the news very often. Should people get that also?
Yeah, it's probably less, you hear about it probably less because you don't have to get it every year. And also because it's mostly given, so there's one kind called PCV13 or Prevnar that's given in children, and then given in older adults, those over 65. And then there's another called the pneumococcal polysaccharide virus, or PPV23 vaccination. And it is also typically given in those over 65 or those who have underlying medical problems.
So those folks, they will have heard this if they are going to their doctor and getting
regularly
information.
going to their doctor, they should be hearing
about that.
Hearing about those 2.
And you mentioned not every year?
No, it's one. So the childhood series is actually 4, but for most people, for most adults, there's 1 dose of the PCV13 and 1 dose of PPV23.
Do I have to make an appointment? Is pneumonia vaccine as easy to find like at the pharmacies and things like that? I don't hear about it as much.
I don't know. I mean, I've seen some signs, so I do think they may have it. It's certainly easy to make an appointment at the clinic for a nurse visit for the vaccination.
And can you prevent, let's run down the prevention steps for flu in the last couple of minutes.
Well, get your vaccine. And then if you have a high-risk medical condition and you're exposed to somebody with the flu, you can take Tamiflu as preventative if your doctor will prescribe it, if you have a high-risk condition. And also just good hand washing, trying to teach children or even ourselves, cough into your elbow.
Okay, so it's transmitted through the air through...
droplet.
It's through a droplet.
Yeah, like sneezing, coughing.
And it can live on for a while, or?
It can. I mean, it doesn't live on forever, but it can live on surfaces for a little bit.
Or sharing cups of water, that kind of thing. That's why so many young people, I suppose, get it.
Yeah.
So this year, how will you determine if this year was a good year for a vaccine? You'll submit data somewhere, or do you follow up with people? How do they know that?
So every positive flu screen at the clinic that information is given to the Minnesota Department of Health in numbers, and then they submit to the Centers for Disease Control, and then they track, and then they will also track which specific strain of the flu you got. So we know, for instance, that the H3N2 strain that's in this year's vaccination was the one that caused the problem last year. And so they'll track does it, are there more of that? Are there more of other things?
Wow, fascinating. I've learned so much in just a quick period of time. Thank you so much. Thank you for your service to Southeastern Minnesota. Sarah Scherger, Mayo Clinic Health System.
Thanks very much.
You betcha. And thank you very much also for joining us here on KSMQ Health Connections. So long.